I'm washing my hands. Hi, my name is Courtney. I'm going to be your nurse for today. Can you please state your name and date of birth?
Christine Schultz, 11070.
Okay, and then do you have any allergies, and if so, what is the reaction?
No allergies.
Okay, so I'm going to first start by assessing the heart rate and the respiratory rate. So I'm going to go ahead and do that on the radial artery. I'm going to first determine if the pulse is regular or irregular. If it is regular, I'm going to count for 30 seconds. If it is irregular, I'm going to count for 1 minute. I'm going to count the pulse for 30 seconds and then the respirations for 30 seconds. I'm going to multiply each of those by 2. So can I please see your arm? I'm going to go ahead and locate the radial artery. The pulse is regular, so I'm going to go ahead and start counting for 30 seconds. So the heart rate was 74 beats per minute, and then the respiratory rate was 16 breaths per minute. And then the pulse was also a 2+ grading bilaterally, or not bilaterally, 2+ grading. So next, what I'm going to go ahead and do is assess orientation to person, place, time, and situation. So go ahead and tell me your name again.
Christine Schultz.
Okay, and then can you tell me where you are?
The doctor's office.
Can you tell me the date?
October 29th.
And then can you tell me why you're here?
Regular health checkup.
Okay, so the patient is alert and oriented times 4. And next I am going to inspect the facial symmetry. So the external facial structures are symmetrical bilaterally. And now I am going to begin assessing the cranial nerves, and I'm going to start with cranial nerve 7, which is the facial nerve. So I am going to go ahead and have the patient smile. Go ahead and wrinkle your forehead. Raise your eyebrows. Wrinkle your forehead like this, okay? And then show your teeth. Okay, so all the movements were symmetric on each side, and that indicates that cranial nerve 7 was intact. So next I am going to assess the 5th cranial nerve, which is the trigeminal nerve. I'm going to first go ahead and assess the motor function by having the patient clench their jaw. I'm going to feel the temporal and masseter muscles. So go ahead, not yet, go ahead and clench your jaw. Okay, so the muscles contracted equally on each side. And next I am going to assess the sensory function of the face by touching the patient's face with a paper clip. I am going to have them tell me if the sensation is dull or sharp, and then I'm also going to have them tell me where they feel it. So go ahead and close your eyes. I'm going to start.
That is dull on my right forehead.
Okay.
Sharp on my left cheek. Dull on my right cheek. Sharp on my left forehead. Sharp on my left chin. Sharp on my right chin.
Okay. So the patient correctly identified the stimulus and told me whether it was dull or sharp, and they also gave me the correct location. So that indicates that cranial nerve 5 is intact. So next I am going to go ahead and inspect the eyes. I'm going to begin by assessing the lids. So the lids are free of edema, lesions, ptosis, and redness. So next I'm going to inspect the conjunctiva. I'm going to go ahead and pull your eyelids down and then look at your eyelids above here. Okay, so the conjunctiva is moist, and it is also smooth and free of swelling. So next I'm going to look at the cornea. And the cornea is clear and free of any debris. So next I will be assessing the third cranial nerve, which is the oculomotor nerve. Then I will be assessing at the same time cranial nerve 4, which is the trochlear, and then cranial nerve 6, which is the abducens. So I am first going to do assess the ocular movements. So I'm going to go ahead and start with the pen, say about 12 inches away from the patient's face. I'm going to go ahead and have them follow the pen with only their eyes through the 6 cardinal fields of gaze. Go ahead. So the eye movements were smooth in all 6 fields of cardinal gaze, and no nystagmus was present. So that indicates that, well, actually now I am going to test the cranial nerves for accommodation. So I'm going to test them for corneal light reflex. So I'm going to go ahead and shine the light in the patient's eyes, and then just look forward for me. So the light reflects in the same area on both eyes, indicating parallel alignment. So these 2 tests indicate to me that cranial nerves 3, 4, and 6 are intact. Next, I am going to assess the second cranial nerve, which is the optic nerve. I'm actually going to assess the third cranial nerve, which is the oculomotor nerve, and I am going to assess the pupillary response to light. I am going to first begin with direct light exposure. So go ahead and look into the light. Okay, so both pupils constrict equally. And now I am going to assess the consensual light or pupillary reflex. I am going to shine the light in one eye and look for the response of the other. Okay. So the pupil opposite to that of the light exposure contracted equally with the one that was exposed to the light. So next I am going to test the same nerve and test accommodation. So I'm going to begin with the pen here. I'm going to have the patient keep their eyes on the pen. So as the pen got closer, the eyes converged and the pupils constricted. And then these tests indicate that cranial nerve 3 is intact. So next I would be assessing cranial nerve 2, but since I do not have a Snellen chart, I'm going to explain what they would do. So I would have the patient stand 20 feet away from the chart. I would have them cover one eye. I would have them read the chart to the smallest line they possibly could. Then I would have them do the same thing with the opposite eye covered. And then if they can read down to line 8, that indicates that they have 20/20 vision, and also that cranial nerve 2 is intact. So next I'm going to test hearing and cranial nerve 8, which is the vestibulocochlear. So I'm going to go ahead and whisper 2 words on each side of the patient. I'm going to have them repeat the words to me. So I'm going to say 2 words and then just tell me what they are, okay?
Apple chair. Cup pen.
So the patient correctly stated the 2 words that I gave, and they correctly stated the 2 words that I said on each side, and this indicates to me that cranial nerve 8 is intact. Next, I am going to assess cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagus nerve. I am going to have the patient say ah, and I'm going to go ahead and look in their mouth while using a tongue depressor. Not yet. Go ahead and So the uvula and soft palate rise in an upwards fashion symmetrically. And then this indicates that cranial nerves 9 and 10 are intact. Next, I am going to assess cranial nerve 12, which is the hypoglossal nerve, by having the patient protrude their tongue and then push against the depressor with the tongue. Okay, go ahead and stick it out and then push against. Okay, go ahead with this one. All right. So the strength is symmetric and smooth, and bilateral strength is apparent. Next, this will indicate to me that cranial nerve 12 is intact. Next, I am going to assess cranial nerve 11, which is the accessory nerve. I am going to have the patient shrug their shoulders, and then I am also going to have the patient turn their head, and these will both be done against resistance. So for the shoulders, go ahead and shrug. So the strength is symmetric, and there are strong contractions in each of the trapezius muscles. And then I'm going to have them go ahead, and then I'm also grading that strength of 5. So I'm going to go ahead and against. Okay, go ahead. So the sternocleidomastoid muscle contracted equally on both sides, opposite to the head turn. And then the strength was a 5. And I am going to then state that that indicates that cranial nerve 11 is intact. So next I am going to assess the hand grasp. I'm going to have the patient grab my hands pretty tight. So the strength is equal bilaterally, and the strength is a 5. Next, I am going to assess the lower extremity strength. So I'm going to have the patient lay down and go ahead and scoot up on the bed so your legs, and then go ahead and extend your legs for me. So first thing I have you do is raise your leg, and then I want you to push down against my hand. Okay, go ahead and do that with the other. All right, now go ahead and bend your knees. They can be touching the bed. I'm going to have you do one at a time. So I'm going to have you, don't bend your leg for me. Don't bend your leg. All right, grab the other one. Don't bend your leg. All right. So now I'm going to push your knees apart and then try and keep them together. Okay, now spread your knees a little bit. All right, I'm going to try and push them together. All right, so the strength was very strong in the legs, and it was equal, and I am giving the legs a 5 grading for strength. So you can sit back up. Your assessment is done. Do you have any questions?
No, thank you.
All right, no problem. Have a good rest of your day.
You too.
Thanks.